And in Washington, Trump's big, beautiful bill narrowly passed the U.S. Senate and is currently being looked at again by House Republicans. President Trump wants lawmakers to get the bill to his desk by the 4th of July, but some here in Michigan are worried the passage of it could really hurt those relying on programs like Medicaid and food assistance. Zach Prees spoke with leaders at a few advocacy organizations. He's here for you now live in the studio with what they're worried about. Good evening, Zach.
Good evening, Jorma. And they're worried that it'll do too much damage to social safety net programs like Medicaid and the Supplemental Nutrition Assistance Program, or SNAP. But the Trump administration is praising the bill for its tax cuts and focus on border and national security.
Just like anything that's cut in terms of income, it cuts buying power. And folks who are trying to survive day to day are trying to feed themselves. And if you don't have food, you don't eat.
The Senate's bill would shift some SNAP costs to states and has new work requirements associated with benefits, something Susan Cankro with Advent House Ministries says can work, but it has to be done right.
Years ago, they had the Food Assistance Employment and Training Program funded by the state, I believe at the time. At that time, they required people who had food stamps to work. It was not a bad program, but it required the support of the state.
She says the state needs to help individuals with transportation, clothing, and other costs associated with looking for a job in order for a work requirement to be effective. Others, like Monique Stanton, the president of the Michigan League for Public Policy, worry what will happen to Mid-Michigan's mental health services if the Medicaid cuts go through.
Medicaid is actually the biggest payer for behavioral health services in Michigan. And so that includes mental health, so services for individuals with mental health conditions like depression, anxiety.
She says there are already delays when seeking mental health care and fears this bill will only push more people to the brink.
When we take away or reduce that option for behavioral health services and substance use disorder services, it's really alarming because it ultimately means people will need to wait in order to access things like treatment.
And Stanton warns that waiting for treatment could prove deadly. And both her and Cankro wonder if there are cuts, if the state will be able to pay the difference to keep SNAP available for as many Michiganders as possible. Back to you.